Hello everyone, I'm Dr. Victory. Welcome back to my channel. So today's topic is on metabolism, basal metabolic rate, that is BMR, and also on some basic idea on weight loss. Now metabolism is a complex process. It's a life-sustaining chemical reaction. It is a process in which the calorie that we eat or drink, when it combines with oxygen, it releases energy, and that energy we use for our normal body functions, for our normal body activities. Now metabolism has got two parts, that is anabolism and catabolism. In anabolism, what happens is the energy that we eat or the calories that we eat is converted into energy, and that energy is used for the building blocks or for the synthesis of proteins, nucleic acid, or peptides and some carbohydrates, etc. Next is catabolism. Catabolism is the breaking down of food particles or the breaking down of the calorie into energy, or converting the calorie that we eat or drink into energy, and that energy is used for cellular processes, for our body activities. That was about anabolism and catabolism. So anabolism is utilizing the energy for building blocks or the synthesis of proteins, nucleic acid, some carbohydrates, peptides, etc. And catabolism is the breaking down of the food particles and converting it into energy for our normal body activities. That was about anabolism and catabolism. So anabolism and catabolism go hand in hand, it go at the same time. Now next is basal metabolic rate. So what is basal metabolic rate? It is the number of the calorie that a person can burn when the person is at rest, at normal room temperature, without doing any activity. So it is the number of the calories that the body can burn when the body is at rest without doing any activity at normal room temperature. So that was about BMR. Now let's talk about fat cells. What are fat cells? Fat cells are also known as adipocytes. So there are two types of fat cells. The first one is white adipose cell or tissue. The second one is brown adipose cell or tissues. So what is white adipose cell or tissue? So white adipose cells or tissues are responsible for the storing of fat in our body, right? The fat, like if we take extra calorie in our body, when we take extra calorie in our body, some are used up, some are utilized by the body, and some extra calories or extra fats are stored in the body as triglyceride. And where are they stored? They are stored in the white adipose cells or tissues. So the fat that are absorbed in the blood are stored in the white adipocyte or white adipose cells or tissues, right? So when we check your blood level, when you find there is high number of triglyceride, more than the normal, that means you are at risk of serious health problems. So you should be very careful not to make yourself overweight or obese, because in that case your triglyceride, that is the fat, will be stored in the body, which will hamper your health, which will spoil your health. Next is brown adipose cell or tissues. This brown adipose cells or tissues is only responsible to generate heat. It is only to create heat in your body. It is for thermogenesis. So brown adipose cells or tissues are found to be more in newborn babies, in children. You can see that in newborn baby they do not shiver. That is because of high number of brown adipose cells or tissues present, especially on the behind the shoulder blades. Also it is found to be more in children. It is also found to be more in the case of women and thin people as compared to those who are fat and men. You should also remember that brown adipose cells, that is only for heat generation, for thermogenesis. It has nothing to do with weight gain or obesity, right? So that you must remember, brown adipose tissue or cells are for thermogenesis, right? So as our age advances, brown adipose cells or tissue starts declining, right? So older people have less number of brown adipose cells or tissues. That was about fat cells. Now coming to the basic idea on weight loss, the first is calorie deficit and second is physical activity or exercise. So let's see calorie deficit. Like example, every individual has a normal calorie intake, right? And this calorie intake, it also depends on your height, on your weight, on your gender, on your age, and also on your physical activity, right? So like take the example, like I will take my example. If my normal calorie intake daily is about 1500 calorie, and in case if I want to lose weight, then I have to reduce some calorie from my normal calorie intake. Example, if I have to lose my weight, then I have to reduce my calorie intake. So instead of taking 1500 calorie, I will take only 1000 calorie. That means I have to reduce about 500 calorie daily from my normal calorie intake. That means instead of taking 1500 calorie, I will end up taking 1000 calorie only. And if I continue doing that every day for about 7 days, then I will end up losing 0.5 kg, that is exactly 1 pound, right? If I continue doing that, if I continue having a calorie deficit of 500 daily, instead of taking 1500, I have to take only 1000 calorie, making a deficit of 500 calorie. Then in 7 days, I will lose about 0.5 kg. That means in a month, I will lose about 2 kg, right? If I continue doing that for a month, I will lose about 2 kg in a month. That's a healthiest way to lose weight. That is about calorie deficit, right? It is always good to reduce your weight in a healthier manner. Don't try to reduce your weight as fast as possible, like 10 kg in 10 days or 10 kg or 15 kg in 1 month. That is not good for your health. It will spoil your health. It will hamper your health. You will start looking sick. You will be weak. You will not be able to perform your daily activities normally. You will be always tired. You'll be frustrated. You'll be stressed out, right? And also you will end up being sick. So that is not good. So reduce your weight in a healthier manner, adapting a healthy lifestyle. The second one is physical activity or exercise, right? Exercise or physical activity is important if you want to lose weight and if you want to lead a healthy lifestyle. That is because, as I said earlier, if you lead a sedentary lifestyle, then you will end up being sick. You will be at risk of serious health problems. Especially inactivity leads to cancer, right? When your body's when you lead a very sedentary lifestyle, in that case, and you don't move at all, like you move you do not do much of physical activity, in that case you end up even suffering from cancer. So, and also it also depends, exercise also depends on your health. You know, some people can do severe exercise, some can do moderate exercise, some can do mild exercise, some cannot do exercise at all, right? It depends. It also depends on your health conditions. So if you have got any health issues, kindly consult your doctor or your physician. They will guide you in what kind of exercise suits you the best, right? So for people who have got certain health issues where they cannot do exercise at all, at least they can walk. Walking is a very good way of exercise, you know. Walking, I've seen people, you know, who does exercise and who does walking, you know. Surprisingly, when you walk, you end up losing even more calories than you exercise. So that is what I've seen in people. So these are the two things, that is calorie deficit and physical activity. You must remember, in the case of weight loss, diet plays 80% and exercise plays 20%. Right? And for those people who cannot walk for a longer time, at least try to walk for about 10 minutes in the morning, 10 minutes in the afternoon, as well as 10 minutes in the evening, that is after your meal, right? Especially after your lunch and dinner, you can walk half an hour after, or just 20 minutes or 20 minutes or 15 minutes of taking your lunch or your dinner. You can walk for about 10 minutes, 10 to 30 minutes, or even 1 hour. It depends on your health, because walking is a very good exercise. What happens is, after you have your meal, so when you have your meal, after exactly 72 minutes of having your meal, that is, you can see after 1 hour of having your meal, your blood sugar level spikes, your blood sugar level increases, right? So it is very, very important that you start moving your body, you start burning those calories, you know, within 1 hour of having your meal so that you don't suffer from any health issues, especially diabetes. It will also help to reduce your weight. So that was about calorie deficit and physical activity. So friends, in my next video, I'll be talking more on my weight loss journey. Friends, that was about metabolism, basal metabolic rate or BMR, and basic idea on weight loss, also on fat cells. You can also take those medicines that I've said earlier for obesity or weight loss. I repeat the medicines again, they are Calcarea carb, Graphitis, Thyroidinum, Fucus vesiculosus mother tincture, Phytolacca berry mother tincture, and also Calotropis mother tincture. The matter of taking the medicine, everything I've explained in my previous video on obesity and effective homeopathic medicine. Kindly watch the video, friends. That's all for today, friends. Take care, stay safe, stay healthy, stay at home. Take precautions. Bye.